Oh, welcome back. Patients are bearing the brunt of the Nehawu strike. It's currently underway around the entire country. We're keeping a very close eye on it. It is having an impact on healthcare for patients. One example is Manqoba Hospital in Johannesburg. The people seeking medical attention have even been turned away and have been told to come back another time. 10% wage increase is the demand from the striking employees, and it's having a devastating effect. Just how bad is it this Wednesday afternoon? Here's eNCA's Manqoba Mchunu joining us outside the hospital. And last we spoke, you'd even cited one individual, Manqoba, who was in a wheelchair and was there, I think it was for chemotherapy even. Tell me if I am remembering that incorrectly. And was told to go away and come back another day.
Well, certainly, Gareth, and in fact, this is what we've been hearing from the many patients that have been told that they cannot be attended to today due to the fact that it is now a full-blown strike. The nurses and essential workers are also out here on the streets. They've been part of this protest. We recall, of course, that on Monday, government had indicated that it's not going to allow any of the essential services workers to take part in the strike. In fact, we know, Gareth, that there was also an interdict by government, the Department of Public Service and Administration, over the weekend to try and halt the strike from going on. But of course, the union, Nehawu, appealing that particular interdict. They also went to court on Monday after government had went to court again to try and effect that interdict from taking place. But really, it is the patients that have been bearing the brunt of this particular impasse. In fact, the whole day we've been seeing quite a number of patients that had to turn back, Gareth, simply because many of the departments here are operating with skeleton staff, and some of them, we understand, have grounded to a halt, so they were not able to service those patients that have been here. Some of them have been coming here for appointments. Some of them have been coming here for checkups. We saw the elderly as well as people with disabilities being turned back. And one of those was an 89-year-old lady that we spoke to, who was in a wheelchair. There was a wheelchair from the main entrance of the gate. Of course, patients have not been able to go to the hospital entrance itself in vehicles because of the barricades that have been placed here on the road leading to the hospital's entrances. So many of them have had to walk quite a stretch just to go to the hospital, only to be turned back, to be told that they'll have to make appointments for other days. But just to get an update, as far as the strike is concerned, there was a meeting that took place here between the leaders of Nehawu as well as some of the striking workers. I'm going to speak to the Provincial Secretary of Nehawu, Mzikayise Chonchi. Thank you very much, Mr. Chonchi, for your time. Let's just start here. You had a meeting just a short while ago. What's going to happen with the strike? Is it still continuing?
Our strike is continuing until we are satisfied that there has been an impact to such an extent that the government is showing signs of listening. At the present moment, we are not at a point where we can say that the strike is not going to continue. Our demands remain, and from where we are standing, we are still met with arrogance by a government that does not really care about workers. And it is our position that this strike must continue unabated until such time that this government takes a decision to listen.
Aren't you worried, though, about the patients' lives? Because we've seen many of them being turned away. In fact, we saw even a lady that was coming here for chemotherapy earlier on saying that she's been turned away. Are you not worried as a union, the risk that it's putting on patients' life and the consequences thereof, given that we know that nurses are essential workers and by law they cannot partake in strike?
Naturally, we should be worried about the impact of any strike on the community. Unfortunately, as workers, we are exercising our democratic right to withdraw our labor when we are in a dispute. And as I can tell you today, we have approached the Department of Health and asked them for a discussion on the minimum services that we can provide. To this point, we don't have any response from the department. And the obligation for essential services does not only rest with workers, it rests with the department as well. Our expectation is that both of us as actors, we must make sure that this happens. I can tell you that these members did not just come out of volition, that they decide that they want to come out to work. There's a reason behind this. And the reason is because, one, the government is attacking the collective bargaining system in this country. Two, the government is denying workers an increase that is they are deserving. Three, we're defending a democracy. From 1993, we had gains that this democracy afforded all citizens of the country, including the workers themselves. But this government has embarked on an onslaught against all the gains of democracy, including collective bargaining. And if this democracy is to be defended, we are one of the people that will stand in the front and defend the democracy. And unfortunately, if there has to be a moment for us to fight, it is now. Because we are put in a position where we can only choose one option, to fight. Because the government abandoned collective bargaining. They forced 3% down the throats of workers. They forced other positions that they put down the throats of workers. There can be no expectation that we are going to fold our arms and watch when the government is undermining the very foundations of our democracy, and we are expected as workers to watch. Unfortunately, as the unions in this country, we've taken a decision that we are going to take a stand. And that stand is to make sure that we defend the gains of democracy. We fight for better and improved conditions of service for workers. We fight for improved salaries for workers. That's why we are here. We are definitely concerned about what is happening right now. That's why we are approaching the department to talk about minimum service. I can tell you, here in Charlotte Macleck, this branch has approached the employer. And this branch did not only approach the employer, they actually implemented that thing of minimum service. There are areas where the employer approached that party, we agreed that here are the people that are going to make sure that services are running. And that is our commitment. That's our commitment. Because we don't want to collapse the healthcare system. We're not fighting with the community. We're fighting with our employee.
All right. In terms of talks, what's happening with talks? Are there any indication that there will be talks that are going to be held and that perhaps there's a better offer on the table?
Unfortunately, there's no better offer on the table that we are aware of. But we know that the PSCBC is convening all of us tomorrow. But there's no offer on the table. So for now, the strike continues.
Thank you very much, Mr. Chochi, for speaking to us as the Provincial Secretary of Nehawu. Just giving us an update as far as the strike is concerned, of course, saying that they're not fighting with the patients. The intention is not for the patients that need these healthcare services to be bearing the brunt of this particular impasse, but what they are fighting for are decent wages, and they're saying that government needs to accede to their demand for a better wage. They're demanding 10% and government is offering 4.7%, and these workers saying that they're simply not going to accept that. They're going to continue with the protest up until government accede to those demands.
Yeah, and just to remind you as well, as we leave Manqoba Mchunu just outside Charlotte Macleay Hospital, 4:10 this afternoon, going to be hearing from the Eastern Cape Department of Health on the very same issue. So we're staying on top of this ongoing strike with Nehawu. It is having a devastating effect on patients and their ability to get the health care that they so desperately need. We'll go back down to Manqoba again later in the day.